Welcome to our channel. Today, we're diving into a historical phenomenon that has affected millions throughout human history, the bubonic plague. Often referred to as the Black Death, this disease has shaped societies and changed the course of history. The bubonic plague is caused by the bacterium Yersinia pestis, which is primarily transmitted through fleas that infest rodents, especially rats. These fleas bite infected rodents and then can bite humans, transferring the bacteria. It's important to understand that the disease doesn't spread directly from person to person, but it can have a secondary spread if respiratory droplets from infected individuals enter the air in close quarters, leading to another form of the plague called pneumonic plague. The most notorious outbreak of the bubonic plague occurred in the 14th century, between 1347 and 1351, famously known as the Black Death. It swept through Europe, Asia, and North Africa, leading to the deaths of an estimated 25 to 30 million people, roughly one-third of Europe's population at the time. This catastrophic loss had profound social, economic, and cultural effects, leading to a decline in the workforce, shifts in power dynamics, and widespread social unrest. Symptoms of bubonic plague typically appear within 2 to 7 days after exposure to the bacteria. The initial symptoms include fever, chills, weakness, and swollen and painful lymph nodes called buboes, which is how the plague got its name. If untreated, the infection can lead to septicemic plague, where bacteria enter the bloodstream, or pneumonic plague, affecting the lungs and leading to severe respiratory issues. Historically, the lack of medical knowledge and understanding during the Black Death resulted in widespread fear and superstition. People believed they were being punished by God, and many turned to extreme measures, including fleeing cities, self-flagellation, or resorting to witch hunts. In reality, medical practices of the time were ineffective, and quarantine measures were rudimentary at best. Today, however, the bubonic plague is treatable with antibiotics, granted it is diagnosed in time. Public health measures, including effective sanitation, improved living conditions, and better understanding of disease transmission, have significantly reduced the incidence of plague outbreaks in modern times. Interestingly, the plague is not entirely eradicated and can still be found in certain rural areas across Africa, Asia, and the Americas. For instance, the United States recorded several cases annually, particularly in regions like New Mexico and Arizona, where the bacteria still exist in wild rodent populations. Preventative measures include avoiding contact with wild rodents and ensuring pets are protected against fleas. If you live in or travel to endemic areas, being aware of the symptoms and seeking prompt medical attention is crucial. While the bubonic plague is now relatively rare, it serves as a reminder of how infectious diseases can impact humanity profoundly and unpredictably. In summary, the bubonic plague has left an indelible mark on our history, showcasing the importance of public health, sanitation, and how quickly diseases can spread. It reminds us of the ongoing need for vigilance and research in the field of infectious diseases. Thank you for joining us today. If you found this video informative, please give it a thumbs up and subscribe for more educational content on significant historical health events. See you next time.